Next, we'll hear from Cliff Leaf. He's the editor-in-chief of Fortune magazine. Under Cliff's leadership, Fortune has expanded its focus on healthcare. Cliff is the founder and co-chair of Brainstorm Health, an annual conference that convenes business leaders who are rapidly changing the face of healthcare. He's also the editor of the popular newsletter Brainstorm Health Daily, where he offers insights and analysis of groundbreaking advances in healthcare. And if you haven't subscribed to it, you should. It's really a go-to source, and it is free. Cliff is a seasoned journalist whose resume includes the New York Times and the Wall Street Journal's Smart Money magazine. He's also a leader in the fight against cancer. He authored a book based on his award-winning Fortune cover story, Why We're Losing the War on Cancer and How to Win It. I'm also happy to say Cliff is a past winner of our NIHCM Journalism Award and serves on our judges panel, which we greatly appreciate, so thank you. So with that, with insights into fast-moving companies, Cliff has his finger on the pulse of what's next in healthcare that he'll share with us right now. Thank you.
Thank you, Nancy. That's great. Let's see. So it is a little strange for the editor of Fortune to be up in this group. You know, I really don't have anywhere near the expertise as this august group here. What I do see, I pretty much see as an outsider and from the perspective of business. And I can tell you that what's changing is quite a lot. We are, just to give you some background, we are closing our Fortune 500 list today and tomorrow, our big, giant Fortune 500 issue. I should not be here, but I am, because you can't say no to Nancy. But what's really striking is how many, not only traditional healthcare companies, but companies that are newly involved in the healthcare space, populating that list, which is, of course, the largest companies by revenue in the U.S. Can you guess how many of them? Right, 500. So it's about $3 trillion that we spend. It's a huge part of the economy, about a fifth of the economy, and that is amply reflected in the list. We also were noticing quite a lot of one big trend, which was the way data was being used and transforming this industry. And we devoted our April cover story to that, which was written by Erica Fry and Cy Mukherjee. And it's a terrific piece. I know I probably should say that about all our pieces, but I really do love this piece because it actually dives into the way that there really is a transformation happening here. And it's being driven by this. By data. This is your data, interestingly enough. It's what you spend and what goes in your body and what comes out. And it's all of your medical tests and your biopsies and your medical history and all of that. Genetic tests, genomic profiles, X-ray information. And it works out to about 750 quadrillion bytes a day, give or take a few quadrillion. That's about 30% of the total world's production of data every day. And it's coming from essentially you and your bodies. You know, we've actually always had the data. It's always been around. I love this quote from Eric Tobel, which really, basically, the difference is the analytics, right? So we've had the data forever, but our ability to interpret and learn from that data is really what's changing. And you know, there's been a lot of hype about big data. We've heard that phrase for so long, particularly in business. And you know, it's I think had been a disappointing one for a lot, but I'm actually very optimistic that where we're going to see the biggest transformations and the realest transformations, the most authentic ones, are in the space of healthcare. So with that, what happens when big data meets biology? Well, a lot. So Nancy asked me to do 10 trends, and she said, God, they love lists. People in Washington love lists. So whatever you do, just put numbers on everything, and they'll just eat it up. So I'm hoping that that's the case. But these 10 big trends, I'm leaving out a lot of what is happening in the scientific world, in CRISPR, for example, the gene editing technique, or cancer immunotherapy, which I actually spent a lot of time thinking about and writing about. Liquid biopsies, What I'm really trying to focus are on the day-to-day business transformations that are really being led by this data revolution. And so what's happening, and this was alluded to before by Gail, is a realignment. And it is kind of extraordinary when you think about it. You can see my messy little slide here that I just put together last night. But this is all, and the reason I did it just for this last night is this just is since December, okay? When you think about the one on the left, it's a Fortune 500 commercial bank, investment bank, consumer bank, JP Morgan Chase, partnering with a holding company, a Fortune 500 holding company that invests in trains and airplanes and owns Dairy Queen, and then the everything store, Amazon. And together they are reconceiving the way they think healthcare can be done for their employees. We've got, obviously, Aetna and CVS, an insurer and a drug retail chain. Interestingly enough, the one on the lower, this Comcast recently announced that it was going to partner with Independence Health on a consumer-focused health platform. I don't know what that is. And there are rumors that Walmart and Humana may partner up. So you see this extraordinary change that's happening. And I didn't even mention Apple, right? So you have the iPhone maker, iPod, and iTunes creator becoming an iHealth company, and really, really getting deeper and deeper into that. Now, when I asked some folks about this, they said, well, listen, it's really about the size of the market, which is incredible. When you think about what Facebook and Google do, it's advertising, and it's about a $200 billion market for them. Well, health could conceivably create 15 Facebooks and 15 Googles based on just catering to this particular data challenge. So what does this all go right away? I think that the second big trend is patient-centrism, is that we've had this information asymmetry in the past, where essentially patients were the last people on earth to get the information about what was happening to them. Providers had that information, doctors, insurance companies, what they were spending, how much things actually cost in the real world. And this is transforming. We're now starting to see the information flow go the other way towards patients. It's fascinating because a lot of these companies that are coming into this space are companies that specialize in consumer focus. So it's the Apples of the world and the Googles that understand what you want and how you like to get their information. And they are the information companies, essentially, repackaging something as personal, something that couldn't be more personal, which is your health information. This is this new ecosystem that we're starting to see, and patients are now becoming really at the center of it. I think that one of the things that's really interesting is the real-world applications that we now take for granted. I want to talk a little bit about this family, the Amos family in the suburbs of Denver. And the mom, Nancy, had discovered that her child was a little sluggish. He was an 8-year-old boy, had never been like this before. She took him to the ER, and they did a blood test and found out that his blood glucose levels were just off the charts, about 750 milligrams per deciliter, well more than it should be, and it was frightening. So they ended up at first doing what most families do. They had the daily tests, the hourly or near hourly test on the strips and everything, checking that glucose level, and Nancy was a wreck. There was no way to be a normal kid, too, that every couple of hours he'd have to go to the nurse's office or wake up in the middle of the night to have a strip test. Well, two technologies, the continuous glucose monitoring, partnered with a smartphone, completely transformed this. So with a continuous glucose monitor, where there's an electrode that goes under the skin, there's no blood sticks, and with the smartphone, he now has information on his Apple Watch that allows him to monitor his glucose every 5 minutes if need be. His mother watches secretly from her iPhone. She won't talk to her kid about it. But so she can take the worry out of this. And this has transformed a kid who had a profoundly debilitating illness into something that's actually chronic and manageable. It's not a cure for diabetes, and I was excited to hear Pat talking about the possibilities of that, type 1 diabetes. But this is a profound change that's consumer-centric and based on all this technology. And there's another thing that's interesting that's come out of this, which it's not just the change in his everyday life, but the fact that he can learn what spikes that glucose level, whether it's what sort of foods and when best to time his insulin shots so that they are not, after a big pizza meal or something. So that knowledge that has come to the family has completely transformed their life, and it's, of course, data-driven. This brings up the point, which is that we're really not talking about a new technological challenge. A lot of what is happening here is a social and a behavioral challenge, because the consumers, the companies that will win in this are the companies that are addressing how consumers ordinarily consume data. And those are the ones that you think about. And a lot of the traditional companies are actually thinking about how that's going to happen. So let me give you a good example, which is EHRs. Now, we've heard about Apple getting into it, but first let me talk a little bit about EHRs, electronic health records, electronic medical records. There is nothing more hated in the health space than this, other than perhaps HIPAA. But I think pretty much electronic medical records are more frustrating for physicians and nurses and hospital staff and everybody in the process. Just to give you a great stat, there have been, 593 scholarly articles on physician burnout due to EHRs since 2015 in the medical literature. The American Medical Association with Dartmouth Health did a study that they found that 49% of physician time in the office was spent dealing with EHRs or other desk work, and only about 33% with actual patients. So Apple comes along and shocks everyone, says, hey, we're going to partner with a few hospital systems. In January, they announced it was 11 systems, then recently went up to about 39. And what this is putting your medical records with a click of a button on your iPhone. And it's incredibly, incredibly accessible. And that's the word that I think is so critical there, is accessibility. Now, there are a lot of other developments. Lakeland, which is a health, Lakeland Health, which is in Michigan, reworked its own EHR with some of the data that they've got, incorporating handheld devices, so nurses could be by bedside and just incorporate data. And they put wristbands on patients to feed the data automatically to the EHRs. And not only did they see a reduction in medical errors and incredibly happier staff, but something amazing happened, which is that they saw a 56% reduction in the number of code blues. Now, why would that be? Well, it turns out that they had an AI system, artificial intelligence system, hooked up to the new EHR system that actually gave a risk score to their patients and warned them when there were some issues that would create red alerts. And so they were able to catch those problems before they became code blues. So I mentioned AI just a second ago, and Gail discussed this in her talk as well. This is a major trend that's happening, and number 4 for those of you who are counting at home, so I get credit for the list. I think what's really important here is that AI is democratizing care. What we're seeing is through machine learning and being able to read x-rays and other unstructured data, or we're using a smartphone to be able to diagnose retinopathy in the field, or being able to diagnose or at least warn of a cardiac arrhythmia that could be dangerous, or sleep apnea that could lead to other kinds of problems. Those are the kinds of things that can be done on a mass scale and be done anywhere. And that's really with a combination of AI and telemedicine, machine learning and telemedicine, we have a potentially transformative situation. Another area is in being able to do things like match patients with clinical trials. A good example, the Mayo Clinic used IBM Watson to match breast cancer trials, patients with trials, and they found that in one particular trial setting, or in breast cancers in general, they were able to match 80% more patients to trials based on an AI protocol. So this brings us to trend number 5. And the reason why I'm doing this is that everybody talks about precision medicine, but really that's about intervention. And when you're sick and things break and we have this pinpoint intervention, and of course by that point a lot's already broken, and the human organism is so complex that when we think about precision medicine, we're often sort of stuck in our own hubris. We think we can fix these things that are broken and sometimes take decades to break. Precision health, though, is a really interesting take on this, and my friend Lloyd Minor, who's the Dean of Stanford Medicine, talks about this. It's a re-looking, a re-evaluating of the kinds of things that make us well, and using the data around us to understand what the parameters of wellness are so that we can actually keep that wellness going. And so I think that's going to be a fundamental change as we get more and more of this data and understand it better, understand our sleep pattern, understand what foods work for us. We all know about people who've gone gluten-free. Well, what other food allergies do we have that we don't even know about it? What's giving us acid reflux at night? All of that. The next trend, I think, again, this was talked to, Pat mentioned that great quote, how do we get more heads in beds, which is the fundamental challenge of private hospitals. I think that we're seeing the center of care, thanks to this data, move away from the hospital as the sort of central caring place for consumers and patients. It's a model that is filled with legacy costs. It's difficult to make work. And I think that even though big data and data analytics have actually helped, and there are lots of cases in which sophisticated data analysis has reduced ER boarding times and made it more beds open up, and reduced OR downtimes, for example. All those things we've seen examples of in the real world. But I think what we're going to start to see with data is moving away from hospital settings to sort of care that's in some cases at home, or in clinics, even to the extent of emergency rooms, moving out of the hospitals into outpatient settings. I think we're going to see a little bit more of that. We talked a little bit about reimagining. Pat talked about imagining what's possible, and I think that part of what this data is allowing us to do, and I think there's a real movement afoot to do this, is to reimagine the clinical trial so that we get a process of testing drugs in human patients that we can learn from as we go along. That isn't some big box, one-size-fit-all trial, but one that's dynamic and evolving, and as new information comes in, and we start to see that with many of the new platform trials that have been approved by the FDA and really pushed forward by patient advocacy groups. We're also starting to see real-world evidence come into this, and I think that's a good thing. I mean, I know there are purists out there that think there's only one way to get information, but I've never seen a 757 jumbo liner go through a clinical trial. I've never seen elevators and high-rises go through clinical trials. And so I think there are other ways to judge the safety of things. And so I'm hoping that data will be part of that new paradigm. We're going to start to see smarter drugs, but also ones that are louder. A good example is Proteus has a drug that tells you when it was taken because it reacts with your stomach acid and sends a little alert, a radio frequency alert to a sensor. And why that's important is that when you're dealing with things like Hep C, or you're dealing with very, very expensive drugs, the ability to make sure that there is compliance on those drugs is incredibly important. I think that it's been, depending on who you listen to, it's either a $100 million problem or a $300 million non-compliance or non-adherence to drug regimens. And so it's big bucks either way, but it's more important, it's a chance to actually cure some diseases now that we have better targeted drugs in some cases. And so I think that that's something that we're going to see. There's, I think, an opportunity for artificial intelligence to help to lower the number of failures in drug development. Right now, we have a failure epidemic. It's beyond just, or failure crisis, I should say, where essentially 90% of medicines that initially go into testing fail to make it to market. I believe it was Deloitte just recently looked at the 12 largest biopharma companies and figured out that their return on investment was about 3% on all of their drug investigations, because the failure rates were so enormous last year. And that takes me to something that I think doesn't get that much attention, but I think it's really important, which is the population health aspects. And Pat, you actually mentioned this, just being able to see, with all this data, being able to see things that we can't see with small data. Part of why this might be important is looking at flu outbreaks and being able to identify them early, or mosquito or tick-borne illnesses, now that we're coming into the spring, and identifying those, or foodborne illnesses. Another is looking at something like vaping or other things in the community and wondering what interventions are working or not. And data can help answer the questions that we've had trouble answering in the past. And this takes me to our last, number 10, thankfully, our focus on the diseasome. So here's a new ome for everybody. We have the genome and the proteome and the kinome and the transcriptome, and now a new term that I think we all ought to embrace, which is the diseasome. And what this is a fantastic work from 2007 on this slide, showing these sort of common nodes of gene interactions between all of these diseases. And what we're starting to see with the data is how similar many diseases are in their root causes, or in their commonalities, or in their pathways. And I think that this is something that is going to be utterly transformative as we start to think that will affect all the other things as well, from clinical trials where we start testing individual molecularly targeted drugs against pathways that may cross several diseases or conditions, or just in general, from preventive standpoints, as we think about the possibility of chemopreventive drugs and being able to slow inflammation so that you have an effect perhaps on Alzheimer's and cardiac disease, and cancer even. And I think that this is really a fundamental thing. I want to leave one, do I have time for one quick story? This is a telecommunications network, but really what it is a view of protein-to-protein interactions in a budding yeast. And I bring this up because at this year's Brainstorm Health, there was a woman named Teresa Beach, whose son had osteosarcoma and sadly died of it. He was a 13-year-old boy when he died. And she asked other osteosarcoma parents if they would send her their genomes. And so she started looking at their DNA and organizing it in various genetic spreadsheets, and started to see patterns. And what she saw was a communications network. Now, why this is important is Teresa Beach wasn't just a mom with a now late 13-year-old boy with osteosarcoma, but she was a rocket scientist. She was a NASA engineer in her day job. And she was a whiz with any data. And by getting this data, she was able to see that if there were nodes that she was trying to protect in her day job in satellites, trying to protect those satellite transmissions by making sure there wasn't too much traffic in any one node, or there wasn't something that endangered that node and there was some redundancy. The exact opposite was her goal in cancer, where the aim was to destroy those redundancies and to destroy those central nodes so that you could eliminate the cancer. And the fact is that 3 years ago, 5 years ago, she never would have been able to do this. But with all of the data and the ability of cheap genomes and people going to Foundation One or 23andMe to get their genomes done, and allowed all these patients to just have the information at the ready and send it to her. And at first, cancer researchers were mocking it a bit, and then she started to publish her work. And now she's got partners at the NCI working on several protocols to deal with exactly this. So it's a great story about patient-centrism that incorporates that data. And so I ask you, you know, is it a revolution? I used that word earlier. And, you know, you can see that in the automotive industry when back in 1895, when we were driving handsome cabs and then we went to the Model T, that was a revolution. You know, we're all sort of aware of that. What we're more used to is this, is evolution. My brother-in-law, who's got a 1967 GTO, that one right there on the bottom, will kill me for saying it's not revolutionary. But in fact, you know, as we look at this gradation, this change, it's essentially just the car getting better, 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 better. And so the question is, are we in an evolution in healthcare or are we in a revolution? And I would say that we are actually in a revolution now. And this is, again, another parallel what's happening with the automotive industry. We're actually going through three revolutions there, not just in what's driving the powertrain, whether it's electric or hydrogen fuel cell vehicles, but in sharing, in the entire sharing economy through Lyft and Uber and new other services like that. And also, finally, with autonomous vehicles. So we're going through multiple revolutions in the automotive industry without even realizing it. It just sort of happened in the last 3-5 years. And I believe we are going through the same in health. Thanks.